Hi, my name is Vishal Gupta and I'm the CEO of Seclor. So, cybersecurity or the lack of it has impacted and continues to do that the healthcare industry in a meaningful way. If you look at the 4 or 5 big components in the healthcare industry are the hospitals or clinics, the device and equipment manufacturers, a whole host of cloud services that have evolved around the healthcare industry, and of course the pharmaceutical companies themselves, right, along with patients. And all of these elements were operating in isolation, even if you go back 10 years ago. And all of these different elements are connected more and more, right? So a patient is able to log into online services, to the healthcare providers, and even to device and equipment manufacturers online, see his or her record, and so on, right? All of that. Now, what that has created is a lot of opportunity, because for example, a hospital can today collect a lot of data about the patient remotely and then send it to a third party expert remotely, collect that feedback, send it to a third party diagnostic lab remotely, right, and render a large part of the patient healthcare and diagnosis without ever having the patient to come into the hospital itself. Right. Now, this is great because this expands the reach of the one healthcare facility far beyond the borders of, the 5 or 10 mile borders that typically a healthcare provider is expected to service. The downside of that is because this requires a lot of data exchanges between different entities, that comes with its own cybersecurity risk. Any breach, any compromise in any of these systems can lead to a compromise of the whole infrastructure. We saw that, very not too long ago with the whole AIMS breach, where one could think that, hey, a network breach or breach of the data of AIMS, which is, one of the premier healthcare providers in the country, what damage could it do? And then we all saw what kind of damages personally identifiable data of so many high profile patients was revealed. And the challenge with cybersecurity breaches is that the result of that breach comes out, sometimes 6 months from now, 1 year from now, 2 years from now. We'll keep seeing the impact of that. So regulations for the healthcare industry come in various shapes and forms, right? One is privacy regulation, right? So the government is interested in making sure that healthcare providers manage and store this data that they are collecting about their customers or the patients responsibly. Healthcare regulations like HIPAA and so on have been in existence for many years, even decades. And the very recent DPDPA Act, which affects the healthcare industry in a very, very meaningful way, are more recent, like, a couple of months old. But across these different regulations, they have impacted the healthcare industry in a very meaningful way. A lot of times, healthcare providers see regulations as inhibitors to progress and digitization, and a lot of times they see the regulations as enablers of digital health. And I'll give you, examples of both. So one of the big healthcare breaches in recent times that we heard of in India has been the AIMS breach. But these breaches are not new. These breaches have happened all over, and in other countries, maybe even at a larger scale. So once people read about these breaches, they are scared of sharing data and their personal details with their healthcare providers, right? So that's the downside of these breaches. The good things of these healthcare regulations is that they are making the hospitals and the equipment manufacturers and all these cloud services that have come up, and of course the pharmaceutical companies, far more responsible about how they manage and handle this data. So there's a positive side to regulations. I mean, that's why they exist. But there's also downside, because public announcements of these breaches erode the trust that people have in the whole healthcare infrastructure. So the challenge of identity theft, or more generally data theft in healthcare, is very real. And I'll give you a couple of examples, or at least one very, very high profile example. So one of the most high profile politicians in India, his healthcare records were breached. This is about 3 or 4 years ago. The news did make it to public website and so on. and that the impact of that, that breach was enormous, right? This person was supposed to be the next heir to that political party, and because of his healthcare situation, his whatever his candidature for that post was removed, because everybody realized that there are big challenges on the healthcare side, and he or she may not be able to carry the responsibility. More recently, the fact that there are some really elderly people competing to become the U.S. President of United States, and their healthcare status has been a topic of big debates in United States about well-being and health of the person who's going to lead the country, right? For example, so the challenges and the implications of identity breach in the healthcare industry are numerous, right? People's lives can get affected in more than just their healthcare or health well-being in this particular context, right? Their jobs can get affected, personal lives can get affected, right, and so on. And so Seclor has been at the forefront of security and compliance for the healthcare industry ever since its inception. The company is almost 10 years old now, and in this 10-year journey, we started off as a campus startup within the IIT Bombay incubation program. And I still go back and remember our first office was a place where you could touch all the four walls of the office without moving one step, right? So that's how we started. The company has come a long way. We have 2,000 of the world's largest enterprises, which include some of the premier healthcare providers, healthcare insurance providers, across the whole value chain, from healthcare providers like hospitals to medical devices and equipment manufacturers to cloud services focused on the healthcare industry, and of course the pharmaceutical industry, right? So we've been instrumental in making sure that the whole industry or the whole healthcare segment is able to communicate with each other without worrying about security and privacy of data. Imagine having access to the best heart surgeon anywhere in the world sitting in Kolhapur, for example, right? Or a small town where you would never get access to this quality of healthcare, right? So Seclor has helped some of the largest digital transformation projects in the healthcare industry by making collaboration and sharing faster, better, cheaper.